Let's begin with the first section of our lecture, airway obstruction. And in this section, we will concentrate on the different types of foreign bodies that can cause obstruction in the airway passages. Then we will talk about the etiology, how these foreign bodies can cause the obstruction, what's the mechanism by which they can cause obstruction, and then we will discuss also different types of foreign bodies. They can be irritating type or they can be non-irritating type. What are the different substances that can be included in these two different types of foreign bodies? So all that we will discuss in first section of our lecture. So foreign bodies of the airway passages. We have the how the foreign bodies get access into the airway passages. That is usually by the aspiration of the foreign body into air passages. So once the foreign body is aspirated in the airway passages, that is either can cause obstruction in the airway passage depending on the size and the location of the foreign body. So it's very, very important that we should pay attention, especially in children when they are playing with small stuff, small toys, that they can inhale them or they can put them in the mouth and choke on them. So aspirated foreign bodies are aspirated in the airway passage. They can lodge into different sites. So different sites can be affected by the foreign body that can be aspirated or that is aspirated. We have the larynx, trachea or bronchi. So these are the three common sites of lodging of the foreign body. So it lodges into the larynx, then trachea or the bronchi. The trachea at the end divides into right and left bronchi. So these are the sites where the foreign body can go and lodge and cause obstruction. Site of the lodgement of the foreign body which is aspirated depend on the size of the foreign body. That's very important. If the foreign body is small in size, it can go further and cause obstruction or blockage of the airway passage. If the foreign body is big, it may not go further lower in the airway passages. So size of the foreign body is very, very important. Then the shape of the foreign body. After the size, shape of the foreign body is very important again, depending on where it will go and cause the obstruction and get lodged in the airway passageway. And the nature of foreign body. So three things are very important. First, the size is very important. Shape is important. If it is rounded or if it's pricky or sharp, small rounded objects usually they have ability to go further. They easily pass through the passageways. If the object is sharp, usually it sticks somewhere and it lodges in that spot. So it's very important the shape of the foreign body that is aspirated. And then the nature of the foreign body, we will talk all these things one by one. Nature is also important, whether it's irritating or non-irritating type of the foreign body. So three factors affect the lodgement of the foreign object. Next, the large foreign body. If the size of the foreign body is large, then it is unable to pass through the glottis. So it's usually lodged in the supraglottic region. Supraglottic, we have three: glottis, supraglottis, and subglottic region. So if it's large, it's hard to pass through the glottic region. So naturally it will lodge in the upper part of the glottis, which is supraglottic region. So if it's large, it will, foreign body is large in size, it will lodge in the supraglottic region. Smaller foreign body usually pass down the larynx, moves into trachea or bronchi. So if it is small in size, it will cross the glottis now, and it can go and lodge in the trachea or the bronchi. So it can be in the supraglottic region, in the trachea, or it can be in the bronchi. Foreign bodies which have sharp point or sharp objects, usually pins, needles, they are sometimes can be aspirated accidentally, or by if the children mishandle them, they can be aspirated. A lot of time females who work with the needles, usually during the sewing, they have the habit sometime to hold the needle in their mouths in between their sewing time. So that is an important, sometimes a factor that can lead to aspiration on the needles or pins. So pins, needles, they are the sharp objects that can be aspirated. Stick anywhere in the larynx, stick to tracheobronchial tree. So sharp objects, they can stick anywhere, either larynx, trachea, or bronchi. So these are the different three types: small, large, sharp. Depending on the size, they can be supraglottic region or in the trachea or bronchi if the object is smaller in size. Next, the etiology, causes. What are the different causes, or what are the different foreign bodies in adults and children that can cause airway obstruction? So in children, usually the children are mainly affected for the foreign body aspiration. They inspire anything during play. When they are play with small pieces, like during the Lego pieces, and they have small objects, they have the habit of putting in them in the mouth, and they can inhale them or inspire them. So very common in children. Always first thing that comes to the mind, if the child is playing alone and they choke, usually the first thing that comes to the mind is they may be choked on some object or foreign body they were playing with. Even small seeds like orange seeds, things like that, they can easily put in their mouth and then cause inhale or aspirate them. So they inspired the foreign body during play. Something in mouth, as I mentioned, peanut, common foreign body. Peanut, if they are eating peanut, or if some adult was eating peanut, they were playing around, and a small peanut is on the floor, usually they grab it and put in the mouth. They always have the tendency to put the objects they find in the mouth. So small peanut is the common foreign body in children. Then we have non-vegetable matters like pins, needles, etc. that can also get aspirated and cause obstruction. Then in adults, what are the causes in adults? Aspiration during coma. If the adult is conscious and they are of healthy mind, usually this doesn't happen. It is more common in children. But if the adult is in coma, not conscious, then they can aspirate or inhale different things. During deep sleep also, If they are intoxicated, alcohol intoxication, they are not in their senses, they can do that. Loose teeth and denture is a common cause in adult. Somebody who wears denture, especially one tooth, usually it can be aspirated and cause obstruction, and also during anesthesia. So very common in adults is a denture, loose denture, which can be which moved, especially during sleep. When they are sleeping, it got dislodged and it can be aspirated and cause airway obstruction. Next, nature of foreign bodies. Nature of foreign body, non-irritating. What are the different non-irritating type of foreign bodies? Plastic, glass, these are non-irritating. Metallic foreign bodies, relatively non-irritating. So these are some relatively non-irritating foreign bodies. Then we have this usually non-irritating type, they remain symptomless for a long time. If they are irritating, especially the seeds and all those things which have the ability to swell up once they are inside, they can cause obstruction and produce symptoms rapidly. But some individual, if they have pins and needles, most of the time, if they are not causing any symptoms, it stays inside for a long time, and it sometimes got dislodged and passes in the stomach, and sometimes even comes out of in the fecal matter also. So depending on irritating and non-irritating, it can stay in the body for long or short time. Then we have some irritating type of foreign bodies. Vegetable or foreign bodies like peanuts, they have the tendency to swell up and they can cause obstructions. That's why they come under the irritating type of foreign bodies. Then we have they set up diffuse violent reaction, cause the congestion in the chest, lead to bronchitis, swell up with time, lead to airway obstruction and suppuration in the lungs. That's why they come under the irritating type. Even if you notice the classification seems like, oh, that was pin and needle glass, why that comes under the non-irritating type and the peanut under the irritating? Because it is causing more reaction. As a result of swelling, it can cause congestion and it can cause obstruction, and it cause serious effects or symptoms later on. So that's why it comes under the irritating type, not under the non-irritating type, because of the effects caused by these foreign bodies. So that concludes our first section, in which we talked about the different types of foreign bodies and how they can cause airway obstruction. Thank you for watching sqadia.com.